Welcome to Health Hats, the podcast. The reason I wanted to talk to you really was that I loved your comment about how you communicate in your community with storytelling and play. Could you say a little bit about that? That is so cool.
Yeah, in sub-Saharan Africa and in many other low and middle-income countries or regions, you find that people love drama. We have what we call education and entertainment. Combine them, we say edutainment. So when you have drama, which is serial, meaning that the next episode follows the previous episode, people want to know, this week, this thing happened to Bernard. What is going to happen next? So that alone is enough to motivate people who want to listen to the program. And now we also have to find a strategy that would make more people want to participate in it. We have to know, say, birds of the same feather flock together. So community health workers have been engaging with community members. Why don't we involve them in being part of the delivery of this messaging? So we decided that instead of the typical programs where doctors, pharmacists, nurses are the ones who go to the radio studios and talk, we want to train community health workers to be the people who go to the studio and discuss the drama. We also want them to be the one answering questions from the listeners. So we designed a radio program called 10 plus 10 plus 30.
Okay.
The first 10 minutes is the 10 minutes drama. The next 10 minutes is 10 minutes of discussion where a journalist will ask two community health workers in the studio, hey, in this drama, Bernard did this. Why did you think he did that? They will answer it. Then after some time, after 10 minutes, the next 30 minutes, they open the phone lines and say, hey, listeners, we've been talking about this. Now we want to hear from you. Then they have questions, they ask, and then the journalists pick the question and give it to the community health workers to answer. When we did that in Ethiopia, it increased vaccination rates so high. In Ghana, we also used that on childhood nutrition, and it improved significantly. In fact, the Ghana project, we published that just last month, and the Ethiopia one, we published that in 2022. Yeah.
Wow, that's so cool. Being a multimedia producer myself, this is music to my ears. Just music. It's that's the coolest thing I've heard in this conference.
Oh, thank you.
Absolutely the coolest thing.
Thank you.
Are any of these recorded?
Yes, so they are in the local languages. So the Ethiopian ones, because
there's translation.
And that is the thing also about radio.
Yeah,
the local people use their own voice.
Yeah,
but also what is missing sometimes in the scholarly world is the fact that we are not using radio for interventions. That much.
It's so cool.
So
thank you.
Good.
I host, write, and produce Health Hats, the podcast, with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.